owns childbirth? The question is the subject of an upcoming community conversation about the economics of childbirth. And here to tell us about it is the event's featured speaker, Jennie Joseph. She's a midwife, healthcare educator, and 2002 Time Magazine Woman of the Year. Good morning, Jenny.
Good morning. Thank you for having
It's
me.
so nice to have you here. Jenny,
Yes.
you've said that the system too often puts profit and convenience ahead of the health of mother and child. Can you explain how that is?
Yes, absolutely. One of the things that's really clear about the United States and the way we do healthcare is it is about money, right? So right away, you have to factor that in that most of the healthcare that you're going to receive has some relationship to capitalism and being profitable. Unfortunately, maternity is the largest health dollar spend in the United States. And so you can imagine then that there's a sort of this inbuilt incentive, if you will, to make sure that it's profitable. Well, it's not, because it's not profitable unless you do maybe surgeries. You sell menu items, epidurals, you sell all of the parts that go with birth so that you end up adding it's quite a bill. I mean, most people are paying maybe 30,000 for a birth, more if it's a C-section. It's really an interesting conundrum because this doesn't happen anywhere else in the world, right? In the rest of the world, midwifery is the modality for taking care of normal, healthy women, which is the majority of childbearing women. And that is a much more cost-effective model. And it makes sure that people have access to be taken care of in a physiological way, right? But what we have in the United States, unfortunately, is more of a surgical approach to birth, right? Inductions, interventions, cesarean sections, and thereby we now are in a bit of a dilemma because it's one of the most expensive things that can happen in a hospital situation, but it's also most detrimental to women's health and well-being.
So not everybody, I think, understands truly the difference between a midwife delivery and perhaps a hospital delivery.
Yes.
Sometimes they work in conjunction with each other. Can
Yes.
you sort of explain what the parameters are?
Yes, absolutely. So a midwife takes care of normal, healthy, straightforward cases. So that's during the pregnancy, labor and delivery, and in the postpartum period. Midwives are trained professionals, similar to nurse practitioners, similar to mid-level providers. And so the majority of those positions in other countries are taken up by midwifery. It's the normal way to take care of birth. The difference here in the United States is that obstetricians are the main providers of maternity care. The obstetricians obviously are highly trained, expensively trained, and also expensive in the need to be reimbursed adequately, appropriately. Subsequently, when you have highly trained, skilled physicians taking care of normal in the when we talk about childbearing is quite normal. It's very boring. In fact, it can be quite straightforward. Hence, people will have babies by the side of the road because once the baby's coming, it's coming, right? So this is the dilemma we have in terms of how do we manage to take care of a normal event without costing all this extra money and without using these really highly skilled, way past what is necessary for the average birthing person. That's our dilemma.
Can I ask you, do you think that there is more fear around childbirth? I mean, it
Yes.
does seem that I've talked to a number of young women who really fear the process of
Yes.
childbirth. We know that it's been done for centuries.
For millennia.
Yeah, millennia.
Mhm.
It is a natural process, but it's
Yes.
something that a lot of women I think anticipate as being incredibly difficult.
Yes.
And I wonder if that plays into, opportunities to incentivize alternatives or interventions.
Yes. Well, if you think about historically, everybody was born at home. America was delivered by midwives. As the fledgling country, America brought midwives, enslaved midwives, indigenous midwives were here, immigrant midwives, as they came into the country, delivered everybody. And so normal birth was taking place in homes. And there were some dangers, obviously, because that's obstetrics. Once we moved people into the hospital, the mid 20th century was when this took place. Obstetricians stepped in and decided that they were going to be better at delivering babies. And so we ended up with this whole idea that it is something to be feared. In essence, it was created. The fear was created. I call this industry of fear-based industry of childbirth, right? That the tools were used, the forceps, for example, the vacuum extractions, and again the surgery, having the C-sections. People were anesthetized. People were put in stirrups. This was the taking of a normal process and turning it into a process supposedly fraught with danger. Hence, now, even now, we still have this sort of inbuilt fear something could happen. And we are all also seeing horrendous maternal mortality statistics in the United States. And that's an awful, I mean, it's a disgrace that a developed country, in fact, the most developed country in the entire world, has statistics that reflect some of the developing nations. We are losing mothers for childbearing in a number that has, in fact, worsened in the last 25 years. And particularly low income women who are marginalized, and Black women and Indigenous women suffer more, 3 to 4 times as many more are dying just having a baby in the USA. So, yes, fear is in the picture.
The statistics are really always shocking to read. And as you say, the U.S. has the worst maternal mortality rate when compared to other wealthy developed countries. But within that bad statistic, women of color are,
Yes,
2 to 3 times likelier to die in childbirth, to
yes,
have adverse experiences.
yes,
And, you've written and researched and spoken a lot on the subject of that
yes,
disparity.
yes.
How solvable is it?
Well, you see, I think what we have to really do is, first of all, recognize what is the real root cause. Because it's not about, oh, well, Black women's bodies don't work, or Black women are too fat, or any of these tropes that have shown up around it. And this is really where we get to the bottom of it. It is the root cause is racism. The root cause is structural and historical ways of being that are harmful and that are in, the bias that shows up, whether it's implicit or explicit, is so baked into our systems that we are actually seeing these preventable deaths, preventable harms that could have been taken care of if we were able to consider how to have a more equitable system.
Can
And
you give some
mhm,
examples of how that plays out? An
yes,
example of
for
yeah.
example, I mean, right now we have 1 in 3 women in the United States having a cesarean section, right? That's surgical birth, 1 in 3. We've also seen that we've got people who present to a physician with concerns or complaints and they're not listened to. And in not being heard, they are put back into, further back on the list or on the line for getting taken care of or just ignored. Right. So when you have someone who presents to, say, an emergency room with a high blood pressure, if that person is of color or indigenous, they may not be treated the same way or as with the same level of interest or speed. And that's again because of these implicit but also structural and biases that are almost baked into our systems, right? So our insurance status, classism plays a horrible role in this as well because of our, well, what type of insurance do you have? And is it good insurance? Is it Medicaid? Are you uninsured? Oh my gosh, you're undocumented? All of these things play into treatment plans, care plans, and the delivery of this service when it comes to having safe, equitable maternity care.
One of the areas that you have focused on is the perinatal
Mm-hmm.
period,
Yes.
and you've asked that people take what you call a perinatal pause. Can you just kind of briefly explain
Yes.
what is that?
It's well, perinatal means before, during, and after birth. So it's not just about the labor and delivery one day that happens in the maternity cycle. I'm looking at this from a holistic eye, and I'm asking people to slow down a minute because we've been talking about this for, well, I've been in this country 35 years. And that's how long we've been talking about it. First, it was infant mortality. Now it's maternal mortality. But we're just talking. The solutions are right there. What we've seen, especially in our practices, it's not about midwifery alone. It's simply about having birth and health be a human right, having respect and dignity, listening to clients, making sure they're heard, making sure they have autonomy. These are the solves because we see in our practice, and many people who work the same way that I do, full term babies, healthy weight babies, breastfeeding mothers, mothers surviving. I've never lost a mother in my entire career. The thing that we have here is that we have an inability to see behind the structure, past the structure, and allow and support people to work differently. Everybody who's in this field loves their work. They're passionate about their work. They didn't come into this work to cause harm, but the structure has to change so that we can be able to really treat everybody with humanity. Make sure that we cover not just that labor and delivery day, but throughout, before they're pregnant. Infertility is a big problem in the United States. During the pregnancy, of course, labor and delivery, but postpartum. Where's the postpartum care? A 6-week checkup does not constitute postpartum care.
Right.
women are left bereft with horrible overwhelm, depression, stress. They're back in the workforce. We don't even have paid maternity leave. It's a systemic, a structural problem. And if we were to address that, if we were to acknowledge that, we would have this solved in I mean, two shakes of a lamb's tail, as they say.
It is the subject of an event tonight. You are going to be joined by Dr. Chandra Adams, who our listeners will recognize, a local OBGYN and a women's healthcare economist. But this event tonight is at HCA Florida Memorial Auditorium. It's called Birth Economics and the Maternity Crisis. Jennie Joseph, thanks for the work that you do. Thanks so much for being here.
Thank
Appreciate it.
you. Appreciate it.